Greetings, my public health colleagues. I'm going to begin my address in People First Standard in the spirit of inclusivity. So I am a gray-haired, brown-skinned woman. I'm currently sitting at my computer and wearing a black dress to provide this address to you. So anyway, good afternoon to all of you. Aloha. I am so happy and so honored to be providing the greetings for your 2024 annual meeting. Um, as a public health practitioner, 40 years, and a physician of 30 years, I am truly so humbled to be stepping into this esteemed role within the association as your president for this upcoming year. Um, APHA is just an incredible and dynamic association. And whenever I think about APHA, certainly whenever I go to any of our conferences, I always think about this sense of belonging that we have. I think that when I first arrived at an APHA meeting and was first introduced to it, I saw all of these people with a single-minded purpose of really improving their community's health, improving the nation's health, no matter what field they were in. And I was like, oh, these are my people. This is where I belong. And so all these years later, that's really still how I feel. So I'd like to say that I think inclusion, belonging, cultural humility, advocacy, science, research, and of course, action, those are not just our buzzwords that you see on the website or that we talk about when we go out into the community. They're really our core beliefs. They're really how we move in the world. And I believe that whether we're at the local, state, or national level, you see all of our colleagues exhibiting that in the work that they do. So I'd like to just briefly introduce you to some of my thoughts and priorities for the next year. I know that many of you read them last year, but I'd like to just give you some idea of how I will be moving this year as I travel across the country and see many of you. And then I hope to also see many of you in DC. So I do believe that we got it right when we said that racism is a public health crisis, of course. I agree with Dr. Jones about that. I do believe, however, that all of us are trying to achieve health equity, right, for all of our populations, for all of our peoples, for all of our communities. And in that, I believe that we need to think more broadly about what achieving health equity looks like. And so that means that I'm going to be challenging us this year to really think about equity in the sense of disability status, gender identity, LGBTQ plus status, aging, my gray hair, aging, ethnicity, and indigeneity. And actually, having said that, I have to say how incredibly happy and excited I am that we have our first Native Hawaiian on the executive board in your own Dr. Donna Marie Palakiko. Just, it's wonderful, and we're really excited about what we can achieve this upcoming year. So that was my first priority, right? Broadening how we think about health equity, how we approach it, and how we work together. Io Magwood, she's a social scientist, and she says that none of us in this current time are to blame for the past, right? But we are all collectively responsible for the future. So I often say to folks that, yes, there are many peoples in this nation who have suffered multiple traumas and sometimes multiple victories as you know, as we've become this nation. Um, I think, though, what I've seen in APHA is that we have gone into our own constituent groups to try to achieve health equity and better health for all of our people in small and big ways, right? But this year, what I'm challenging people to do is to maybe step out of the silos of those constituent groups and work together as allies to show the strength of all of us, right? My saying, my tagline last year was leveraging our collective strength. And I think that as long as we are only staying within our silos, working on the health of our respective peoples and groups, that we will not accomplish that. We must work together. And so that is my number one ask of you for this upcoming year. My other advocacy points for the year are really things that I've been doing for almost my whole career. I have always been an advocate for and will continue to be and support policy and funding efforts around maternal and child health, now known as reproductive justice. I really want to continue to challenge our philanthropic funders and the government on how they approach funding for public health, right? That's my third priority. How they approach funding for public health. Are they really thinking about sustainability? Are they really giving them the funding to the right people or groups? Are they really making it easier for a small community-based organization or a minority serving institution are they making it easier for that entity to receive the money and to administer it or to even apply for the money? A 60-page grant proposal is challenging, right? So we'll continue to work on that this year. And then last but not least, growing and nurturing new public health professionals. I love that. I've been an associate dean, a dean, and I continue to encourage people to enter the field and help us as we become this army of folks working towards the public's health. So in closing, I just want to say that I know that there are plethora, excuse me, of urgent issues, pressing issues that we need to deal with right now. And I know that there's a great deal of strife and division around the world. But what I'm asking the folks within the association to do is to not let that strife infiltrate our ranks. We are the role models, we're the protectors, we're the builders. We are the invisible shield. And so we cannot fall apart, right? We cannot fall apart. So I have basically one more ask of you, and that is I'm imploring you, please, to vote as if your life and the lives of those you love and work to keep healthy, both here and in the US, both here in the US and around the world, depend on it. I hope that you did vote. And I hope that by the time you receive this message from me, we will have an administration that has a productive and wonderful attitude towards the work that we do in public health and can achieve better and more sustainable funding for all of us. So I would say that APHA has a remarkable past. We have a very challenging present. But if we continue to adapt and leverage our collective strength, we can have a limitless future. All of our peoples in this nation, all of our folks in this multi-ethnic, wonderful nation. And so I say, e pluribus unum, we stand together, we cannot be broken. We are many voices, many thoughts, many disciplines, many talents, and we're all united in one force for the health of our communities and our world. So thank you for everything that you do. Thank you for your dedication. Thank you for your service. Thank you for your caring. Hopefully I will see you on my travels this year. Hopefully I will definitely see you in Washington, D.C. Now, let's get back to work. Thank you.